Hey everyone! Today, the condition we will be talking about is called ankylosing spondylitis, which is also known as axial spondyloarthritis. And for the purpose of this presentation, it'll be referred to as AS. This condition is a type of arthritis that causes inflammation in certain parts of the spine, ankylosing meaning stiff or rigid, and spondyle meaning spine. And then itis means inflammation.
AS affects multiple systems across the body. This includes the musculoskeletal system, ophthalmic system, cardiovascular system, pulmonary system, gastrointestinal system, neurological system, and the renal system. AS causes many detriments to the body. This includes symptoms, physical function, work limitation, psychological impact, side effects from treatment, and financial costs. More than 70% of patients experience daily pain and stiffness. Patients would risk an 11% chance of death for complete symptom relief, indicating severe distress. Functional disability is often mild but worsens over time, particularly with hip or peripheral arthritis. 47% of patients report mobility issues, making daily activities challenging. Up to 85% of patients remain employed but tend to change to less demanding roles. It is also seen that up to 1/3 of patients take prolonged sick leaves due to the symptoms of AS. 20% of patients report emotional health problems, with 31% of these patients experiencing depression, with seeing a bigger impact in women more than men. Up to 47% of patients report serious side effects from prescribed medication, leading up to 40% of these patients to stop using them. And finally, direct costs from hospital visits, medication, and therapy tend to put patients in a very high financial strain, making it hard for them to live.
According to the Spondylitis Association of America, AS typically develops between the ages of 17 and 45. However, most individuals experience the onset of symptoms in their 20s or 30s. A 2022 study found that the average age of onset worldwide is 26. AS progression varies among individuals. While some may experience only intermittent back pain and stiffness, others may develop more severe symptoms over time. Studies indicate that around 1 in 4 people with AS experience symptom progression. Several factors can influence disease progression, including being male, having joint damage at the time of diagnosis, having an active disease state, or elevated inflammatory markers that indicate spinal damage. AS can technically begin at any age, but symptoms typically emerge in late adolescence or early adulthood. During the early stages, individuals may experience lower back pain and stiffness, which can be intermittent. As the disease progresses, pain may extend to other areas of the body, such as the neck or shoulders. However, this progression can take many years or even decades.
As AS advances, inflammation may spread from the spine to other joints, which includes the hips, shoulders, and ribs. The disease can also impact tendons and ligaments, causing pain and stiffness. And beyond the musculoskeletal system, AS can lead to complications which may affect the internal organs. For example, between 6 to 14% of people with AS develop inflammatory bowel disease, a rate significantly higher than the general population. Along with that, up to 50% of individuals with AS suffer with osteoporosis, which increases their risk of fractures. In advanced cases of AS, spinal fusion may occur, which is what happens when new bone forms between the vertebrae, joining them together, which reduces flexibility. While AS typically begins in early adulthood, it is rare but not impossible for it to start later in life. And if an older adult experiences lower back pain, other causes should be considered first. The progression of AS is not the same, however, for everyone. Some individuals experience only mild symptoms, while others may develop more severe movement issues, a hunched posture, or complications affecting the eyes, digestive system, or nerves. And although AS itself does not directly impact life expectancy, certain complications, such as cardiovascular disease, may increase the risk of heart attacks and strokes.
Exercise is a crucial tool in managing and alleviating symptoms of AS. By improving mobility and reducing pain, the right exercise routine can significantly enhance the quality of life for those with this condition. Due to AS's inflammatory nature, certain exercises are best suited for symptom management. Low-impact activities like Tai Chi, yoga, swimming, and walking help improve flexibility while minimizing strain. Strength training, particularly core exercises like Pilates, supports spinal stability, reducing mechanical stress. One of AS's hallmark effects is kyphosis, or forward curvature of the spine. Thoracic extension exercises, such as those in yoga, can help improve posture and decrease spinal deformity. Additionally, since AS can restrict lung expansion by affecting the ribs, breathing exercises are essential for maintaining lung capacity and overall respiratory health. Beyond physical benefits, exercise stimulates endorphins, acting as a natural painkiller and supporting mental health in AS patients. Incorporating exercise into AS management is essential, if not only for enhancing mobility, but to reduce inflammation by supporting mental well-being. Whether through yoga, strength training, or simple daily walks, movement helps with the symptoms of AS.
Mechanisms that help with AS. Improving flexibility. As AS makes your joints stiff, like rusty hinges on a door, regular stretching or exercises like yoga act like oil, keeping those joints loose and mobile. This helps because flexible joints make daily tasks like bending or turning less painful and more natural, helping you stay active. Strengthening the muscles around the spine. Your spine needs strong support, especially as AS weakens it. Core exercises targeting your belly and back are like adding extra ropes to hold up the tent pole, stabilizing your spine. This is helpful since stronger muscles take pressure off of your joint, reducing pain and helping you stand or sit comfortably. Promoting better sleep. AS pain disrupts sleep, but regular exercise tires you out in a good way, helping you fall asleep faster. Quality sleep lets your body repair itself, reducing daytime pain and stiffness. Boosting mental health. Living with AS can be tough on your mind. Exercise releases feel-good chemicals and gives you a sense of control, like hitting a mental reset button.
Research has evolved significantly over the years on the understanding of ankylosing spondylitis causes, genetic factors, and treatments. The earliest research was showing the potential role of HLA-B27 gene and its factor in getting AS. HLA-B27 contributes only 16% of the total genetic risk for the disease. In 1973, a very strong association between the HLA antigen B27 and ankylosing spondylitis was first reported in the journal Nature on March 9, 1973 by Caffrey and James. This study found that HLA gene is present in over 90% of patients with ankylosing spondylitis. Early stages of research show that this gene was increasing the risk of developing this disease, but not everyone with this gene will get AS. Newer research on AS has developed more on the bacterium Klebsiella pneumoniae. This bacterium triggers an immune response that may contribute to AS development. Even with all this new research on the possible factors of AS, the exact cause is still unknown. As we don't know the exact cause for AS, advances in MRI and technologies allow for earlier detection and monitoring of AS. Imaging in ankylosing spondylitis has been comparable for decades with conventional radiography. However, developments in computed tomography, ultrasonography, and particularly magnetic resonance imaging, MRI, has dramatically increased the amount and scope of information obtainable by imaging.
Physiotherapy is central to managing AS, focusing on system control, mobility preservation, and functional improvement. A 4-phase rehabilitation protocol outlines progressive interventions. Phase 1 addresses pain relief and mobility. Phase 2 emphasizes flexibility and postural retraining. Phase 3 integrates aerobic conditioning and strengthening. And Phase 4 prioritizes daily function and maintenance. Evidence highlights physiotherapy's short-term benefits, particularly with exercise, in improving pain, spinal mobility, and physical function. While further research is needed on intensity and long-term efficacy, structured exercise programs, including stretching to preserve flexibility, aerobic activities to reduce fatigue, and postural training to improve alignment, are critical for AS management. Integrating these therapies into daily routines maximizes adherence and outcomes, reinforcing physiotherapy's role as a non-pharmacological cornerstone in AS care.
Research suggests that physical education programs should be maintained continuously to help preserve or even improve the positive effects of exercise for individuals living with this autoimmune inflammatory disease. However, it is important to understand that exercise can have both pro-inflammatory and anti-inflammatory effects in people with inflammatory arthritis. This is why following a structured exercise plan designed by a physiotherapist or a doctor is so important to ensure that physical activity is both safe and effective. It is also important to be aware of factors that can make AS worse, such as sedentary lifestyles, poor posture, smoking, overexertion, and lack of sleep. Without regular movement, there's also a greater risk of losing mobility and experiencing joint fusion. Finally, while any physical activity is better than none, once again, research shows that following a structured workout plan is the most effective and more effective than exercising on your own. Staying active with the right guidance plays a major role in managing AS and improving one's overall quality of life.